How accurate is a barium swallow for GERD diagnosis? Imagine trying to catch a glimpse of what's happening inside your esophagus without surgery or invasive tests. That's where a barium swallow test comes into play. It's a simple procedure that can help doctors see how your esophagus and stomach work together. During the test, you drink a liquid containing barium, which coats your esophagus and stomach. X-ray images then show how the barium moves, revealing if reflux is happening. It can spot if stomach contents are flowing back into the esophagus, which is a sign of gastroesophageal reflux. The test also shows if the lower esophageal sphincter, the muscle that keeps stomach acid in place, is working properly. Plus, it can identify structural issues like a hiatal hernia or narrowing of the esophagus called strictures. Now, how good is this test at diagnosing gastroesophageal reflux disease? The truth is, it has moderate accuracy. When it comes to catching reflux, a simple observation during the test only detects it about 26% of the time. That's pretty low. But if doctors add provocative maneuvers like coughing, bearing down, or changing your position, the detection rate improves to around 40%. If they include a water siphon test, where you sip water to trigger reflux, sensitivity can go up to about 70%. That means if the test is positive, it's quite likely you have reflux. But if it's negative, it doesn't necessarily mean you don't have GERD. Compared to other tests, a barium swallow isn't the most sensitive. For example, 24-hour pH monitoring measures how much acid actually touches your esophagus over a day and is more precise. Impedance pH monitoring can even detect non-acid reflux. Endoscopy, which involves inserting a camera into your esophagus, often looks normal in many GERD cases, so it's not always definitive either. The main use of a barium swallow is to find structural problems that cause reflux or complications like strictures or Barrett's esophagus. It's also helpful to differentiate GERD from other esophageal issues. But it can't reliably measure acid levels or tell if reflux is normal or harmful without additional tests. In practical terms, a barium swallow can be part of your diagnosis, especially if your doctor suspects anatomical causes. But it shouldn't be the only test used to confirm GERD. More sensitive options like pH monitoring are considered the gold standard. So, while a barium swallow offers useful information, it's just one piece of the puzzle in understanding acid reflux and GERD.